I wrote an article after this miracle that happened to us because to me it was so sad. The doctors even said, oh my goodness, it was probably the antibiotics kicking in.
Mm-hmm.
They did not want to believe that something so inexpensive and something so non-toxic, so gentle,
Mm-hmm.
could do a better job than their more toxic treatments.
Julia, you're saying, I believe, in some of your print, that LDN may have a positive effect for HIV and AIDS.
Yes, and I'm sorry, go on.
And some cancers.
Yes. What it does is that it raises the endorphin level. There hasn't been like huge clinical trials on it. There have been small ones. But what they find is that it modulates the immune system. It raises the endorphin levels. In other words, it helps the body to heal itself. It doesn't act like most drugs. And the Dr. Bahari, who is the genius doctor who recently died, who was the pioneer of low-dose naltrexone, originally was working with AIDS patients. And he found that, it was used originally in higher doses, naltrexone. It was used for drug and alcohol addiction, remember? And he found that when they were taking lower doses, their T cells were getting better. And so this was his mission. It almost happened by accident that it started being used for other autoimmune diseases. And that was when his daughter's friend had MS. And at that time in the 80s, there was nothing on the market for MS. So Dr. Bahari reasoned, he says, if it raises the endorphin levels, it can't hurt her. Well, long story short, she had a remission. I guess I should say a stopping of the progression rather than a remission. So then people just started to come out of the woodwork wanting this low-dose, non-toxic, inexpensive drug. And cancer is also a disease of the immune system, as you know.
Mm-hmm. Yes.
And, low-dose naltrexone does not have the horrible effects of chemotherapy. And one of the doctors who's a hero in my book, another one of the heroes in addition to Dr. Bahari, is Dr. Bert Berkson in Las Cruces, New Mexico. And he uses intravenous alpha-lipoic acid, which is another kind of natural substance, but it's infused with LDN. And he has actually had some instances, a lot of them, with pancreatic cancer.
I know someone who died of pancreatic cancer, and it was a very quick death. And I haven't heard of anyone who survived it. Are you saying that this is something that can actually cause a patient to live with pancreatic cancer?
Yeah. One of the chapters of my book is by Paul Mares, who is a 9-year survivor, either 8 or 9, of pancreatic cancer. And he was told by M.D. Anderson that he should go home and die.
Wow. Steve Jobs of Apple Computer is reported to have had pancreatic cancer. You may want to contact him and let him know.
I wish I could, but you know what the problem is with these famous people? They are so hooked in. I used to do this all the time, try to reach some of these famous people,
mm-hmm.
and they have walls around them.
Yeah.
And I guess I'm much more interested. I would love to help Steve Jobs. He actually, he's a fantastic person as far as being so creative.
Mm-hmm.
But I guess I picture him, and I could be wrong, having loads of MDs around him, surrounding him, and doing the conventional. So I concentrate on just plain folks.
Okay. Can you talk about the relationship between diet and some of your treatments?
Yes, I would love to. The diet that I write about is the ketogenic diet for pediatric epilepsy. I believe that's what you're referring to.
Yes, I am.
And this is an amazing thing. This diet, which is a very high-fat, low-protein, low-carbohydrate, especially low-carbohydrate diet, was the standard of care in the 1920s in both the Mayo Clinic and Johns Hopkins. And guess what happened? In the 30s and 40s, we started to have the anti-seizure medications come along. So doctors began to want to prescribe the drugs. They were a lot sexier. They worked faster, you know. And by faster, I mean, I guess that's not true. The diet can work very fast, but it's not as easy as giving a pill. But what happened was a Hollywood producer named Jim Abrams. I don't know if anyone's old enough here to remember the Airplane series of movies.
Oh, yes, most certainly. We're owed.
What? You're old?
We're owed.
Good. Well, remember those silly airplane movies?
I do.
With Leslie Nielsen?
Leslie Nielsen, just a great stand-up comic.
Yeah. Well, Jim had a little boy named Charlie who had what we call intractable seizures. That means they just won't quit. Mm-hmm. And he went to all the big famous hospitals in California, and they kept giving the poor child more and more drugs. They even operated on his brain. Nothing worked. And finally, he discovered the diet. And he took the little boy, Charlie, to Johns Hopkins. Within 48 hours of being on the diet, his seizures stopped. And
wow.
Jim was both excited and then angry.
Mm-hmm. Confused.
You know what? He had been discouraged from using it. He had to find it on his own. And when he did, the doctor said, oh, don't try that. It won't work. And they knew that it worked. In my book, I quote from different years when all the studies that Jim found in the library, from the 20s, the 30s, the 40s, the 50s, you know, all saying that the ketogenic diet works. So he set out to get the word out there. The first thing he did was he produced a movie. I don't know if you know about the movie First Do No Harm with Meryl Streep.
Mm-hmm. Heard of it?
Yes.
And that was a movie that introduced to the public the ketogenic diet because it was about a woman who had a son with epilepsy, tried the diet, it worked. So Jim now spends his life getting the word out there about this diet. He actually hired a dietitian who goes around the world teaching people in hospitals and other medical institutions how to do the diet, because I don't want people to think it's that easy. Mm-hmm. It has to be calibrated to each individual child. But man, once it works, these parents are so happy.
I'll bet. Class, we have a link to Julia Schopick's book and her website, Honest Medicine. You can go to usaprepares.com, usaprepares.com, and you'll find the link on the first page. You can click that, and it'll take you right to Honest Medicine.
Vince, I think it would be absolutely fascinating if Julia would think about coming to a future Get Prepared Expo and do a seminar on this subject matter. I think she would be a huge hit. What do you think?
Well, I think the thought's right on. However, Julia, why don't you tell them what we discussed?
What? That I don't like to travel?
Well, that wasn't it. You had a conflict.
I do. I don't like to travel, and I have been invited to, and I can tell you, it's the Cancer Control Society.
Oh, my.
They are having a conference in California, but I'm not lying when I told you I don't like to travel.
No, that's fine. I'm talking about a future expo. We're going to have multiple expos
I
in the
would
future.
love to be in contact with you, and I'd also love to come. You're wonderful interviewers. I'd love to be on the show again if you ever want to.
We're going to have you on the show. That's a given because there's just so many topics to discuss in your book.
Well, oh, by the way, are there any geeks in your class? Because it's on Kindle and the Nook.
Yeah, we have a lot of geeks in our class. Julia, our classroom is broadcast in 5 states and worldwide on the internet. So, and we're on the same network as George Norrie and Rush Limbaugh.
Okay.
So we're heard far and wide.
This is wonderful.
Julia, we really want to have you back. I'm not closing the interview. We've taken steps to extend this interview for you. What would you like to tell the class that they should do immediately to safeguard their health?
I think the first thing, I hope, of course, live healthy and all of that. That's a given, like you were talking about. But one of the things is a mindset. The mindset is to follow your gut. And if your doctor says, I'm all for going to the doctor and following if the doctor can solve your problem. But in so many cases, like the ones I talk about in Honest Medicine, the conventional treatments just aren't working well for people. And unfortunately, they're believing their doctors that there's nothing else that can be done.
Julia, I have a question from one of our class members. This young man says that when he goes to a restaurant and he eats, he's unable to keep his food down. After 15 or 20 minutes, he's unable to keep it down. Have you found anything that might help him?
No, the only thing that I can look at is to ask him, many people have food allergies, food sensitivities, and he might very well, you mentioned that it was at a restaurant.
Yes, I did.
At least when I go to a restaurant, I often find I eat foods that I wouldn't eat at home.
Yes.
You look first at what you're putting in your body before you look at putting something else in. And I'm happy to hear that. I don't mean happy. I'm so sorry that he's having troubles, but that it only happens in restaurants should give a clue as to something he's doing that's different. So maybe a good nutritionist would be a good answer.
Julia, thank you. Thank you for coming on the show today. We are going to have you back in the future. It's fascinating information, and thank you. And I'm absolutely convinced if people go to our website, hit your link at usaprepares.com, and get your book, that will help a lot of our audience members. And so, thank you. Will you come back?
I would be delighted to.
Great. Well, this is Mark and Vincent on USA Prepares, the radio program. We're going to take a brief break, and we'll come right back.
Street when your index is low. Dow Jones ain't got time for the Okay, Vincent, Mark, I understand that all three of us are scheduled to be off campus for a field trip. Good job. I like field trips. Since you made the arrangements, please instruct our class where and when to meet for the field trip.
Well, we are doing a field trip. Big Ron. Oh, gracious. We are going to be at the Sound of Freedom Indoor Gun Range in Ozark, Missouri this Friday. We're going to do a live broadcast from 3 to 4 p.m., and we encourage you, our class members, to come out and join us. This is going to be a great time. Now, the Sound of Freedom Indoor Gun Range is celebrating their first anniversary on July 4th weekend with a huge sale. Everything will be on sale Saturday, Sunday, and Monday, from clothing and accessories to guns, memberships, and classes. Lane rentals will be half price, and get $10 off of gun rentals. $10 off of any purchase of $50 or more. Concealed carry and basic pistol classes for only $89. $30 off of every gun in stock. When you buy a membership, you get your choice of a free hat or t-shirt. Be sure to check out their everyday low bulk prices on ammo. And don't forget, Vincent, to register to win a Springfield XD 9mm pistol, my pistol of choice, to be given away on the 4th. You don't need to be present to win, but you got to go out there to sign up. The Sound of Freedom Indoor Gun Range huge first anniversary sale is 3 days only, Saturday through Monday on the 4th of July weekend. The Sound of Freedom Gun Range is just 3 miles south of Springfield at Highway 65 in CC, or visit them on the web at sof-usa.com. So we're talking about showing up, Friday about 2 o'clock, have hot dogs and refreshments, listen to us. Who knows, you might get on the show, and then afterwards, bring your guns, let's go bang, bang. What do you think?
I think that's great, but why did you say Vincent when you're talking about the XD?
Because you have a gun that was made, in 1911?
No, actually, it was made a little after 1911, but it was styled, it was modeled after the 1911.
I see. I'm thinking, if you ought to get a gun in the new millennium. Leave that 1911 back in the 1911 and come with the polymer metal, the new gun that will actually work.
Yeah, I understand. Mark, that was an interview. There was a lot of information, and Julia Schopick, I think she helped a lot of people today.
I think so too.